So, Heather Hauka, you're my first guest on what I'm hoping will be an ongoing podcast on conversations on healthcare. Just from my interest is in the U.S. Healthcare is so complex, and we tend to spend so much money on it. And I want to learn more about the U.S. healthcare system by talking to people from around the world to get a sense as to what it's like for them. And so, can you share a little bit about your background, like who you are, what you represent, and like why did we connected?
Sure. Yeah. Hi. So I am Canadian and I'm a Canadian nurse. I work for myself. I have my own business that provides medical copywriting and marketing services for plastic surgeons. And I've been a nurse since 2011 in Ontario, Canada here.
That's great. That's great. And so I'm actually just going to dive right in because full disclosure, we had this conversation last week. And it was phenomenal. I was like so sorry that I hadn't recorded that conversation as well. But part of this is I understand that a lot of kind of the excitement and the energy just comes out in the conversation itself. So again, stepping back, the reason that I'm wanting to chat with people is that the way I see U.S. healthcare is I think that it doesn't function as well as it could or should. And I definitely know that the grass is always greener and there's no system that's perfect. But I'm just curious how healthcare operates in other countries. And so, the first question I had is, how is healthcare coverage determined in Canada? How's it decided who gets coverage and who doesn't?
Mm-hmm. Canada covers everybody who is a citizen with our provincial health coverage. So that's decided by each province. In Ontario here, we call it OHIP. So that's the Ontario Health Insurance Plan. And if you are a Canadian citizen and if you have been here, I think it takes 3 months that you have to be established in this province, then you get your health coverage.
Got it. And what do you pay for that?
We pay for that through our taxes. So there's no additional bill for OHIP services.
Got it. And so what does something like that cover?
OHIP services cover anything that is considered necessary, medically necessary, as well as basic primary health care. So your annual checkup, visit to the family doctor, that kind of thing, as well as anything emergency. So if you go to the hospital with chest pains and you need to get checked out, or you think you have an infection or break your arm, anything along those lines, it covers that. It does cover some other treatments. I'm just trying to think here as well. For instance, dermatology. If you were referred by your family doctor to go get mold checked out and stuff like that, they would refer you and you would see a specialist and that would also be covered.
Okay.
I think it's easier for me to think of what isn't covered.
I'm sure. So the things that are covered sound like it's primary care. And emergency stuff, right? So God forbid you're hit by a bus and you go to the emergency room, you need, an operation, everything there is going to be covered.
Absolutely, yes.
Okay.
Yeah. And you won't be billed either for things like the ambulance unless you've abused that. I have heard stories of people receiving a bill in the mail, but it was for not using the service properly. So yeah, if you
it's
genuinely need it. Yeah, you won't get a bill if you needed it.
Right. Well, and it's an interesting thing as an American to hear that because, it's common. I think I shared this with you previously that the number one reason for bankruptcy in the United States is medical bills. And that can happen from a car accident, right? That you weren't planning on. Nobody was, it's not like it was something you could have foreseen. But you go to the emergency room, they will take care of you. You get a big bill. So, all right. So then, what are the kinds of things that aren't covered? Right. You said it was almost easier to figure that out.
Right. Yeah. And I was just thinking too, one of the ways that I consistently notice the difference between our healthcare systems is just thinking about childbirth. I hear people talk about what it costs to have a baby, and in my mind, I think it doesn't cost anything to have a baby. What do you mean?
Yeah.
It costs something to feed them. It costs something
Yes.
to raise them, but it shouldn't cost anything to have a baby.
Well,
So that
so
always,
let's stay on that for a second because that's
yeah,
an interesting thing. So let's say a couple is having trouble conceiving.
yes.
How would that be something that is covered? So, for example, in vitro fertilization,
IVF?
fertility treatments.
Yeah, that's private. You have to pay for that if you want that.
Okay, and so
Yeah.
any idea what something like that might run in terms of like how would it be covered? Is there an additional layer of insurance that you buy into, or are you paying physicians privately?
Uh, well, I mean, for childbirth, you wouldn't do that because you've got an obstetrician covered by our provincial health care plan. You also now have midwives covered. So if you choose to go the natural route, if you want to give birth at home, or if you want to meet with midwives and kind of have the option of hospital or home, you can do that, and our taxes covered that. Specialist, okay, so what is not covered? Specialist healthcare, naturopaths are not covered. So we pay $200 to visit a naturopath out of pocket. There's no help for that. Chiropractic, not covered. Massage therapy, not covered. Some things like physiotherapy could be covered if you've had an injury or something like that and your doctor has prescribed it. Then you may have a series of physiotherapy treatments that are covered by our provincial insurance. But if you decide on your own that you just want to go and get that particular treatment, you'll pay out of pocket.
Got it.
What is not covered as well? Glasses, hearing aids, which is why I don't have any at the moment. Mine broke and they cost about $6,000 or $7,000. And I'm going to wait and not buy them at the moment.
Yeah.
Yeah.
People, listen, that's something we're very used to is people will save up for a healthcare item, otherwise they shouldn't. So what about medications? So one of the struggles, and I think we chatted about this, is my best example is diabetes. So I have type 2 diabetes. I take a medication. With my insurance coverage, it would cost me $900 a month here, right? And so, frankly, because I drive to Canada and I pay a fraction of what I would normally pay. But how are medications covered, under the Canadian system or under OHIP?
Yeah, they're not. We don't have coverage for prescriptions. What we do have, and what I'm hearing, I think I've heard from you and from a number of people, is generally our medications are cheaper. And I am no expert on this at all. It's not my area of expertise, but my understanding is that our government keeps prices locked down. So they have a system of putting a ceiling on what companies can charge for drugs here, which is great for us because we're paying out of pocket for prescriptions. But on the flip side, we don't have access to every new thing. So sometimes a specialty drug or a new treatment, we won't have it available because our government has decided it's too expensive and we don't need it.
Got it.
And then what about special cancer treatments and things that are really innovative and leading edge? Sometimes we don't have access to that.
Would that be available to somebody who can pay for it? So when you say that a medication might not be covered, does it mean that it's not there at all, or that?
No, because none of them are covered. We don't have a
Okay. Got it.
plan. Yeah. What it means usually is that people go to the States
Okay.
to buy the treatment or special medication, or Europe. You know, we're talking about a bracket of people who have either saved up money and or they have, you know, donations from friends, or they're in a income bracket that they can afford that. I don't know how much of the population that really represents,
Right.
but some people do, yeah, just go to another country where they have access to the drugs and treatment.
There is the whole concept of medical tourism, right? You know,
Yeah,
there are definitely people who will travel to somewhere nice where the procedures are less expensive,
and that's a whole topic too, because I know about that from the cosmetic surgery perspective.
Right.
And I don't know how bad it is with non-cosmetic procedures, but I think the risks of not having follow-up care and not understanding how doctors are credentialed, not understanding how, you know, whether you're going to get surgery and whether that operating room is certified and if it's sterile and if you have a proper anesthesiologist, like, people don't understand what's being said to them in another language and consent forms. So that's a whole potential problem. Yes, traveling.
Yeah, no, absolutely. So, private versus public insurance. Are there levels? Can you buy private insurance that might cover more than what OHIP would be?
Yeah. And again, I'm not really an expert on this, so I can just tell you kind of loosely what I know, and I might say something incorrect, but my understanding is that a lot of workplaces, a lot of corporations provide health insurance plans, and those do cover the things that our regular plan doesn't. So glasses, dental, those are the two big ones. People want to take care of their teeth, and our provincial insurance doesn't do that. So your workplace health insurance plan, people do get really excited when they get a good salaried job here that has medical, because what that means is you get some, you know, you get a few massages covered every year, you get your teeth cleaned, you get glasses, and usually those cover prescriptions.
And do you have a concept as to how much that might cost the individual?
Yeah, well, I think it's different for every business, depending on that business's framework and income and everything. I know that a personal experience I can relay is working for a very small family-owned company that was offering its employees the option of having medical health coverage for the year or taking a chunk of money as a payout and adding that onto their salary. And the amount was roughly $5,000. For myself, for my my role and my income, that was the amount. It was about $5,000. That was the additional insurance coverage for the year, and I took it as a payout because I am not using. I didn't need any prescriptions or anything, and I would rather have the money. Yeah.
So this is what. So they're basically saying, and I'm just using a calculator because I can't think that quickly in my head for math. Under pressure, but so it's, you know, $400 some a month that the employer would be paying, and what you're saying is that you can opt out of that, and they'll actually give you a cash payout. That's amazing.
That would cover just about everything. It didn't cover hearing. Incidentally, nobody wants to cover hearing aids.
Oh, interesting.
Yeah, because when I was considering whether to take the payout or not, I was thinking, well, if they'll cover hearing aids, that's the one thing I need, and they didn't, so I didn't bother.
No, I mean, listen, it makes sense, and we pick and choose healthcare plans based on, you know, the access that it's going to give to us.
Now, I know you mentioned a monthly number for insurance, and it was way different than my monthly number.
Right. Well, so and that is and I think that I was thinking about this. That's something I think I'll mention in each call because it is just so overwhelming. So I have what is, you know, fondly known here as Obamacare, right? It's the Affordable Care Act, and it's what was passed under Obama. And in theory, it was meant to allow medical coverage to more people than had been being covered previously. And so it's been great for a lot of people. It's great for the poor. It's great for people who are homeless or single moms. But for a working family, I pay for the lowest tier plan. I pay about $2,000 a month for a family of 4.
Yeah.
And that covers nothing. Right. So at that point, I have a $7,500 deductible per person. And so I think there is a family cap. Maybe it's, 15 grand that I'm going to be paying over $30,000 in a year before I see any coverage. And that's for an independent. That's for somebody who works for themselves, who doesn't get employer-based insurance. And in the US, the employer-based insurance is how most people get their coverage. And sometimes people have to pay a full amount. $500 a month is not unreasonable. And sometimes people are asked to pay a portion of it. I have a son who works for Amazon, and I think he pays maybe $100 a month. But he gets top tier coverage.
Yeah.
And it's great. It's great healthcare, and pretty much everything is covered. So let me ask you, logistically, right? So primary care, you want to make an appointment with your doctor. Well, actually, let's talk about your doctor. Can you pick and choose who you want to go to see?
Yes and no. It depends where you live. There are places like downtown Toronto where I recently lived, and I just moved out of there. Most of the people I know, people my age and younger, don't even have a family doctor because they can't find one. So a lot of times the story I hear is that there's nobody accessible, there's nobody within their immediate area who is taking patients. They're all loaded up, and they kind of put the brakes on and say, I'm not taking new patients.
Okay.
So people have a hard time finding a family doctor. To offload that issue, our government opened up a number of years ago, opened up a lot of walk-in clinics, and those are essentially urgent care centers. And also places where you can go and get a quick checkup, get vaccinations, get reproductive health help, and all of that at a walk-in clinic. And you'll see a family doctor, but you may not see that same one again if you come back. You're going to get a different one every time. It's like whoever's on call, right?
Right.
And it's kind of a good plan. It certainly helps a lot of people. The downside of that is that you don't get a practitioner who gets to know you, right? And build any kind of relationship at all, and not somebody who's really got the time to follow up with you or anything. But again, time-wise, so I had a family doctor. Since I moved, I haven't found a new one in the city that I'm in. But I did have one for years who took care of my son and I. The great thing about that is if you need to make an appointment, you call, you find out when appointments are available, you book it, you go see them, and it's a familiar face, and it's a doctor who knows you and your son, right? The downside of that, though, is that they typically have about 10 minutes to spend with you, and you don't get to say everything that you've been saving up for who knows how long since you've been to the doctor. If you're me, like years, you don't get to bring all your issues. They don't have time for that. So you really do feel often like it's a one complaint visit, which doesn't really, in my view as a nurse, that doesn't really provide great care. So there is a bit of a give and take.
Can that be balanced with private insurance? Like if you had that employer-based insurance or a private plan, or I guess if you're willing to pay out of pocket, are there doctors who are separate from the public system?
Not really. So yes, typically specialists. So what you would do is instead of going to the family doctor and saying, I have skin issues and I have digestion issues and I'm depressed and your whole spectrum of problems, instead you go to a specialist and you pay and spend an hour with them and they do a very thorough job, right? So it's a matter of, I think, that like a laser focus. You get the option to really focus if you have the money for private specialists.
Got it.
Or sometimes you can wait. So what we have is our GP. You guys call them GPs, right?
Absolutely, yeah.
Okay, so our GP will see you for 10 minutes.
Which is a general practitioner for anybody who doesn't.
Yeah. So they'll see you. You let them know that you've got sore joints and depression, maybe, multiple things. Then they're going to write a referral. And they're going to send you to a psychologist and to somebody to check out your joints, or maybe they're going to send you to a physiotherapist. Then you take that referral and you now book an appointment with that specialist, and you're going to wait another 7 or 8 months to see the specialist. So it is an option that you could be referred to a specialist and still not pay for it, but it's not a quick and easy process.
Okay, so let's take a step back. So, because I missed that. So if you get a referral from your GP because it's something that they say you need, then it's still covered by the provincial insurance?
If it's something that's available, yeah. So many different medical specialists that we have, yeah.
Okay.
I think whatever's not available, it's probably very few things.
Let's even talk about something common, that I'm aware of is like diabetes. I go to see an endocrinologist. That's a specialist.
Yeah.
And so, but
that would be covered.
It would be covered.
Yes, and the thing is that you're not going to just go and get it taken care of in one shot. You would begin a series of appointments and referrals and go through that. Yeah.
But all of that would be covered by OHIP.
Yes, because that's medically necessary. It's
in the U.S. It makes no difference whether something's medically necessary or not. You're going to pay for it.
Really?
Oh yeah. I mean, you are hit by a bus and you go to an emergency room, and if you don't have insurance, if you're at a private hospital, because there are private hospitals and there are public hospitals.
Right. Yeah, and ours is all private. All public.
All public. If you are sent and you arrive by ambulance at a private hospital and you're dying, it's medically, and it's an emergency, they will see you, they will treat you, they will take care of you, and you get the best, some of the best care that you can get. But you will get a big whomping bill when everything is done. And those bills are tens of thousands of dollars, and hopefully it's not something more serious that you're going to need more care for.
So when we watch Grey's Anatomy or House, okay, those hospitals, are those the good private ones you're talking about?
Well, it varies, and actually, so it's funny because my kids, or one of my kids, really encouraged us to start watching House, and I love it because they're bringing up these bizarre cases.
Yeah.
But and it's fairly accurate, but House is so harsh on like the patients. His motto is something like everybody lies. And that's a little harsh, but that is an example of I can't remember if House is a public or a private hospital. There is a show called New Amsterdam, which is about a public hospital. And I just saw a documentary. I might have mentioned it to you, but I'll mention it again. There was a documentary called Code Black. And it's really worthwhile watching for anybody to get a sense of kind of what a public hospital in the United States is like. And the public hospitals basically take anyone and turn no one away. It is our version of free care. But in exchange for that, in Code Black, it was LA County Public Hospital. And there are people who will wait 30 hours to be seen if their priority is really low, right? So let's say you're poor, you don't have healthcare coverage, or you're working and you don't have healthcare coverage, and you have to go see somebody, and you walk into the hospital because you have a sore throat and you just want to see a doctor, as opposed to like an urgent care. They will see you, but because you're such a low priority, it might be a day or two, right? So you will literally sit there in the
we have that here.
Okay.
And that's one of the, so I think we talked about this last time too, that, you know, depending on who you speak with, you're going to hear great stories and horrible stories about our healthcare system. And
both sides.
I often like shift my thinking as well. So I have a love-hate relationship with our coverage here, but one of the negative aspects, and possibly it's rare, but is that people do wait and end up low on a priority list when hospitals are overrun and they are understaffed with nurses. People sit around in ERs and wait. There are some hospitals that don't deal with that too often, and there are others that do. I had a young friend years ago who was brought into the ER by his friends at 3 a.m. They had been drinking, they were at a party, and somebody had hit him over the head. Because they had been drinking and they were kids and it was 3 a.m., the charge nurse in the ER decided that they could sit and wait. And they did. They sat and waited many hours until like the next morning, and he slipped into a coma for 6 months and is paraplegic now because he had been bleeding in his brain the whole time. And that story of just kind of like people getting shuffled off to the side and not prioritized with enough urgency is not the only one that I've heard. I've heard a number of these stories.
Right. But that's an example, I would think. I would put that more into the category of, well, and I'm going to preface this comment by saying that I'm not a medical practitioner clinically, but I've been in medicine for almost 30 years as an administrator or adjunct, and I have great respect and honor for the fact that medicine, in my mind, is as much an art as it is a science. And so a lot of care and the levels of care are based on the individual person that you go see. There are great doctors and there are bad doctors. There are phenomenal nurses and there are less phenomenal nurses. And that sounds like a judgment call that was made by somebody.
Yeah, but they don't make them in a vacuum. So there can be like, caring is essential, but there can be a culture of burnout and people feeling jaded and just, you know, losing their touch because they are understaffed and they're too busy and they can't keep up. So there's definitely,
that's more of a similarity.
We've had some studies on that recently.
Yeah, that's more of a similarity between the systems than a difference, right? Because that is exactly, you know, some of the things that we have here. And I think that's just the nature of a burnt out, like it's no question that regardless of the country that you're in and the level of care, having burnt out medical practitioners isn't healthy.
It's the burnout, right? Like none of those people entered into that work thinking, I'm just going to phone it in. I don't really care. Of course they care. They were all on fire and passionate about people when they started, but you can definitely have hospital administration from the top down that just crushes people's motivation and efficiency, right? Like if you have people working in silos in a hospital and they're understaffed, everybody will burn out really quickly and accidents happen, people fall through the cracks, patient care.
For sure.
Yeah. So that's, like I said, that's not, I'm not saying that is our entire situation and it's all bad, but I have heard a number of those stories. So I think that's the fallout of having everything public.
Right. And again, you know, I think that there's it's this interesting balance that everybody's trying to reach, you know, to give the best care possible given all the circumstances in a given system.
Right.
So going back to wait times, So let's say somebody needs something like a hip replacement, okay, which is a fairly standard procedure that is done on a pretty regular basis,
Yes.
but is not considered possibly a high priority. How would that be handled in the Canadian system?
Right. So we would cover the cost of that, definitely, but you might wait.
What is a waiting time?
A wait could be anywhere from 6 months to a year,
Okay.
kind of thing. Yeah.
And that's
I'm trying to
something the same.
remember. I actually know somebody who just had his knees replaced, and I think he waited more than a year. He was in a lot of pain.
Wow.
He was not able to work, and it was really affecting his life waiting that long. But I've also heard stories where people just zipped right through, you know? So I think it's a little unpredictable sometimes, and it depends where you live.
Right. As to the access for the specialists, orthopedists, or people who do hips or knees. So in the same scenario, your friend who waited over a year, if he had had money, could he have paid and gone to see somebody?
If he had money, he could go to the States and pay.
Got it.
That's what people do. So like when we have to go get an MRI, for instance, and the wait list for your MRI is 8 months, and you think you might have cancer and you don't trust your doctor and you want to get it right away, if you have the money, you go to the States and you pay.
Interesting.
Yeah.
So that, and that is probably, that's another big difference is we take for granted access to all these things. Granted, again, it figures where you fall in the.
It's so interesting to think about these differences, and it's not better or worse. I think we have something better, definitely cost-wise. When you're telling me the kind of bills you're getting, it's just mind-boggling to me. The trade-off, I think, is access.
Right.
We have to wait. We don't get to pick and choose who we go see. If you don't like the doctor they sent you to, too bad.
Right. Yeah.
You get what you get. It's like being in the school cafeteria, and you eat whatever they're serving that day, right? And if you got money, you go to a 5-star restaurant. But if you're in the cafeteria, you're going to eat what the cafeteria gives you. It's kind of like that. And you can say, okay, well, have you not been fed? Yes, you're eating.
Right.
But it is what it is. So sometimes you feel that lack of access to kind of a high level of care that an open market will do. Like if people are competing for your money, the idea is that maybe you could get better service from people who are competing.
Right.
That also excludes how many people who can't even get in the game, though. I don't know.
And that's an interesting thing because that isn't dissimilar here, right? So we also have challenges for waiting. So actually, and this is an interesting example, my endocrinologist has a 1-year wait list. If you want to get into her, it's a year, literally. It's actually even a year to book out. And
this is something you're paying for out of pocket.
Well, so it depends. No, I'm paying for it out of pocket because my insurance doesn't cover it, right? Or my insurance does cover it, but only after I've hit my deductibles, right? So remember, I pay more than $30,000 a year before anything is covered. So it doesn't actually matter. I get hit by a bus hopefully it's the end of the year and I've had to spend that much money. But if it's January, I'm going to pay $30,000 up front.
Wow.
Yeah, it's crazy. But
I can't imagine paying that much.
Well, but there's actually there aren't options. It used to be that you could get what we called major medical, right? You could buy in kind of like just the emergencies will be covered. But I believe that is no longer the case. And the costs just keep going up and they just keep getting passed to the consumer. So it's a constant figuring out of like how do you mitigate that? How do you get care for an affordable rate And how do you
Yeah.
change the system that, you know,
So you notice the money you're paying to insurance because you see that huge chunk of change leaving your wallet every month,
right,
right?
right.
I would be curious to see the numbers because I actually have no idea what the comparison would be like. But when we factor in a higher cost of living and taxes and everything, people who don't utilize our system, so somebody like myself who doesn't use any prescriptions and I am fairly healthy and I don't really utilize the system much, I am essentially paying for everybody's care through my taxes and my cost of living, right? And just like an insurance plan that you never use, I'm not using it.
Right.
But it's these smaller amounts that we don't notice as much. It's built into our everyday life that we're paying for that
So
additional
what
service.
is the tax roughly? Do you know, again, you're not an expert and, you know, I'm not,
Yeah. Well, our goods and services tax on everything is roughly 13%. Property taxes, I have no idea. I know that our income tax is higher than in the U.S. We also, our floor for taxing in a higher bracket is lower than yours, I believe. So a comparison between in New York and Toronto, I was looking at, people have to earn $1 million in New York before they hit the high-end tier. And here, 200K will get you there. So in general, we're paying higher income tax, and then we're paying our taxes on products and services.
right.
And you know, and this covers everything, but I still don't know if that's worse than paying $2,000 a month without.
Well, and at least so in I'm guessing in Canada it's different province by province. In the U.S. it's different
Yeah.
state by state. In the state of Washington, the average tax that you were talking about, for example, on things that you purchase, is 10%.
Yeah.
Okay, so it's, you know, yes, yours is more, but it's not that much more, right?
Yeah. Yeah.
And so I think it's going to come out more in the income tax, and it would be interesting to see. I think I'm going to try to take a look at some of the comparisons, because I do have some Canadian friends who have echoed some of the things that you're saying in terms of this concept that, you know, you pay so much more in taxes. So I really wonder what that is, right? And does it balance out to,
Right.
you know, what we have is we have the newest, shiniest, you know, not necessarily most effective, but, you know, it's brand new and cutting edge. You know, that's the kind of medicine we have. We can save 1-month-old babies, you know, but it comes at a cost, right? At here, everything is, you pay for everything,
Right.
and you pay a lot.
And what is it worth to factor in the lack of fear over going bankrupt over a medical service?
Yeah, peace of mind.
You know, and I know that's a concern for you. Like, that's clearly something that you're thinking
Absolutely.
about.
Right.
And we have the luxury up here. I have the luxury of not thinking about that very often. And what's that worth, right?
Right.
So
No, absolutely. Absolutely.
I would like to know that I have at my fingertips the most leading edge treatments and equipment and medications, everything I could possibly want.
Yeah.
But I don't know that I want to trade that off for this getting bills after you go to the hospital or have a baby. My gosh.
Well, and then even you get bills for things that you don't understand, right? We now have hospitals are trying to cover their additional losses with having to be required to keep certain costs down. So you can actually go to the doctor if the visit was at the hospital, because that's where their clinic happens to be. You could receive a bill for what they call a facility fee. Okay, and it could be the same amount as you paid to see the doctor.
Yeah.
Why is that not one number? And again, so it's not, you know, there isn't a right or a wrong or a good or a bad. It's just, it is a good question. So Heather, thank you so much. This was great. I don't know where it's going to lead, but I always enjoy the conversation. And I appreciate you taking the time today to do this.
No, I'm happy to. We can chat again about medical advertising. How about that? Because that's different. That is different between our countries as well, whether it's cosmetic or conventional medicine as well.
Well, I'll tell you, some of the other questions that I have is, how are providers compensated? That would be fascinating because I would really love to know. And like home health care versus primary care, these are the kinds of things that I have up in my mind in my list of questions that I want to cover. How long?
The quick answer is a lot of that is covered. Yes.
Yeah, I know. But there's so much to dive into. Anyway, Heather,
you have to qualify for it. Once you qualify, then you get to the next level.
Right. Exactly.
Yeah.
All right, Heather. Thank you again. So it's funny. I have to figure out how to end this, right? So this is Saki Lito for Conversations on Healthcare with Heather Hauka, who is currently in, where are you?
I'm an RPN in Toronto, Canada.
In Toronto, Canada. And thanks again, Heather, for taking the time.
My pleasure. Nice talking with you.
So don't go away. Stop. That was great. Thank you.
Yeah, that was great. Yeah, we could talk. Definitely. I was just thinking earlier today about how you can advertise for medications in the States, which has something to do with their higher cost.
Absolutely.
Right?
Well, and not only their higher costs, but the demand. It is very common here for a patient to walk into the doctor's office and say, I want this.
Yeah. Because they saw a commercial.
Yes.
That whole thing doesn't exist here in Canada.
Wow.
Because it's illegal. You can't advertise.
It's illegal to advertise for medication.
Because it's unethical.
Thank you.
But I mean, that's written. I'm not saying I personally have decided that. That is the law here. Like, it's very clear that you cannot be persuading people from your position of power to take a medication or a treatment. It's considered an unethical manipulation of people's trust of doctors and fear.
Have you ever had a headache? You should go see your doctor because maybe you need this antipsychotic medication.
I'm just picturing running on the beach, and that this is pure manipulation. And the interesting thing about that is that when you get into cosmetic medicine and plastic surgery, I would argue that people need to see the beautiful pictures. You are selling a product, but we have a hard time. It's very, very strict. So when I'm writing copy for my clients, I need to understand what the marketing guidelines are, what the Health Canada guidelines are, and then each medical body, the surgeon's board and the CNO that's in charge of nurses, we have our own laws. And we have to follow them. We can't use superfluous language. We can't.
What is that? So, as an example.
This is groundbreaking, amazing. You will not believe it.
Right.
Can't say that. Can't say you're going to look younger. Can't say, oh my gosh, so many things. And you also can't make any promises. So I use a lot of language like, patients have reported feeling such and such, but I can't say you will, right? 9 out of 10
people say they feel better taking, blah, blah, blah.
Right, yeah. And even then, what is better? We have to be careful not to be vague. So we can say, your eczema symptoms should lessen, but we can't say you're going to look fantastic. Right. That's just subjective, right?
Right. Well, it was interesting. Go ahead.
We're a lot stricter here about that.
Yeah. We had a conversation yesterday with my wife and I. My wife's a physician. And we were chatting with somebody in Australia. And it occurred to me, my wife was presenting on sleep. And she was kind of tossing out a lot of very common sleep medications here in the US. But it made me realize that we're so attuned to the brand names of these different medications, and they're used often like candy. Like the number of people that take the drug Ambien, okay, which I can't remember the class, of medication it is, but and it is, life-saving for many people who can't sleep otherwise. But this is also a medication that you can get up, drive, eat, and still be asleep when you're doing it on this medication. And yet it's advertised on TV as like the wonder drug.
Yeah.
Yeah, it's crazy. So anyway, all right, Heather, thank you. And are you going to continue these the interview things that you were starting as well? Are you doing that on a regular basis?
Sorry, which things?
I had seen you do an interview.
Yeah. So the interviews that I did was just because of coronavirus and because I wanted to start practicing interviewing people. And it was just an opportunity to say, okay, here's a subject, and I know some doctors and nurses, so I'm going to interview them. That's not something I plan to continue to do, but I do plan to set up interviews with doctors and other care providers, more like staying in the subject of cosmetic and beauty and wellness.
Totally.
And then, do exactly this, something similar. I want to talk about the things that people find confusing or overwhelming, or safety stuff like cosmetic tourism.
Right.
It's really
I know,
risky.
and I've heard you talk about that. So, and actually that would be interesting too, to like at some point, if you have any thoughts or ideas, I would love to have a conversation, again, like this, on any of these topics. It doesn't necessarily have to be comparisons, but
a good one for you, because like the feedback that I get on my posts whenever I post something medical, and usually it's cosmetic, but I don't have a big audience for that. So the people that write on my posts are people who've had some kind of a bad experience or a scary experience or whatever, and they felt like they didn't know how to advocate for themselves. I get feedback like that, like with people saying, I had this bad experience and it was so hard to communicate, or they celebrate and cheer that, they had a fantastic nurse or doctor, and why was that so good? And it's typically that they listened and they cared, but that people feel like when they enter the health system that they are suddenly hands off and overwhelmed and they don't know what to ask. So I feel like talking about patient advocacy is a big one.
And that is what I'm trying to shift around. But and maybe like you, what I'm realizing is that I'm shifting my focus from actually wanting to do patient advocacy to wanting to talk about it, because not enough people even realize that that it exists. Like you said, people have these experiences where they'll go into a medical scenario and have no idea that there is somebody out there who could actually help them. And a lot of times it happens to be a family member, right? It's not uncommon for someone to bring a family member along who understands, or even just to be a second, set of eyes and ears. I'm going to start trying to do a little more of that as well. So anyway.
I really think people need to know that, and to know that their body is their business. That this is you have a right to ask questions and to understand what's going on. And I would just love to hear people being more empowered to do that. And I want to do that for the cosmetic world, because I feel like there's a massive divide. And taboos. People are too shy and too scared to ask questions, and I want to see them encouraged to do that.
That right there is something, because you've got that very specific market as well that you're targeting. That would be something that you could do really well.